Okay, and we're live. All right, good morning, everyone. Good morning, Facebook. Hello, hello. We just had a great Labor Day weekend, and here we are. We're back to work. I'm Andrea. I'm the program director from SCAN.
Good morning. I'm Marybeth Kwapniewski. I'm the program coordinator at SCAN, and I'm happy to welcome Jennifer Dral as our guest this morning from Ascend. How are you, Jennifer?
I'm good. Good morning, ladies.
Good morning. And you are watching SCAN, FYI.
We always forget that piece.
I know. Details.
Hi, Jennifer. So Jennifer, why don't you introduce yourself and tell us a little bit about Ascend and what your role is with Ascend?
I would love to. So I am the director of sales and marketing for New Jersey. Ascend Hospice is part of the Ascend Health network. And Ascend Hospice brings hospice services to patients in need across the whole state of New Jersey. We bring hospice services wherever our patients live, whether it's in their own residence or a nursing home or an assisted living. Some of the things that we do a little bit differently than some of the other hospices is that we offer some specialized programs for dementia, for cardiac disease, for our veterans, for cancer. So we really believe in a customized approach as opposed to kind of a cookie cutter hospice, because every patient is different, every patient's family is different, so their needs are going to be different. So that's really how we choose to bring our services to our communities.
Okay, so today we're going to talk about some of the myths that come with hospice caring, and I guess maybe an overview of what hospice is would be great to start with for those who are not familiar with what hospice is all about.
Or those who think they're familiar, but probably have a big misconception of what a hospice really means. That's a good starting point.
That's a great question. I think a lot of people are confused about what hospice really is and what it looks like. So hospice is comfort-focused symptom management as opposed to aggressive or curative treatment. The people that come to hospice are usually someone who has a life-limiting diagnosis, a life expectancy of probably 6 months or less, but no one has a crystal ball. So that's just kind of a ballpark. And it's all about managing symptoms and keeping people comfortable and supporting their family during that time. And the focus is on quality of life and giving people really the best use of however much time that they have left with their families and their loved ones.
Okay. Now, since we're talking about the myths of hospices, and I think the very first thing that you had given us to talk about, hospice is a specific place. I do think that it's been my experience too that people think you go somewhere to go to hospice. So let's talk about that.
Yes, that's a very common misconception. I think that most people think that hospice is a place and it's just one specific entity that provides hospice. There are some hospice companies that do have hospice inpatient units, and that's, I think, what people are thinking of when they talk about going to hospice. But hospice really is just the whole service delivery, and there are many different hospice companies out there that offer hospice services. Not all hospices are created equal. So what I always suggest when I'm speaking with family members is meet with a few different hospices. Talk about what each individual company has to offer. Maybe meet the nurse that would be caring for your loved one so that you can really get a feel of how they fit and how comfortable you are with them and how those services really line up with your needs.
So we're also saying that hospice services can be delivered in your own home. Is that correct?
Absolutely. Whether you're in a nursing home or an assisted living or your own residence, we love doing hospice at home because that's where people are most comfortable. That's their home. That's their most familiar surroundings. Many people, if it's possible, choose to pass at home surrounded by their loved ones in their most comfortable, familiar environment.
Okay. And another common misconception is that hospice is only for the elderly.
Yes, I think that people generally think that hospice is either for the very elderly or for people with cancer. And the reality is that hospice is for anyone who needs it. I mean, there are pediatric hospices that care for children with terminal illnesses. For us, we take care of the adult population. but we've taken care of patients ranging from early 20s all the way to 106, and everything in between. So while we do care, of course, for patients who have cancer diagnoses, we also take care of patients who have end-stage cardiac or end-stage respiratory diseases or Alzheimer diagnosis or a stroke.
Mhm.
So really, any life-limiting illness would be something that hospice might be a possibility for.
Jennifer, when does someone decide that hospice may be needed for a loved one? Again, I know there's no crystal ball, but how does someone gauge that?
That's a great question. And I think that kind of varies from person to person. So on our perspective, Medicare gives us this set of guidelines and things that they're looking for, kind of a checklist of health issues that someone might have. So some of the things that might be, okay, well, maybe it's time is, of course, having a terminal diagnosis that you're not looking to pursue aggressive treatment, or maybe there aren't treatment options. We might see someone who's had a significant weight loss and they're having trouble taking in nourishment. We may see someone who, even with medication and oxygen, their oxygen levels are down and they're short of breath. Someone who has CHF may be going back and forth to the hospital again and again over a period of time. That might be somebody that we're looking at. Someone who's had a lot of repeat infections and they're not able to take care of themselves in their day-to-day functioning anymore. Someone who was able to get around and now they're largely bedbound. So those are some of the things that might trigger a hospice referral.
Well, those are many things right there. I think way more than I ever realized. Yeah.
Jennifer, you mentioned Medicare guidelines. So is that covered by Medicare?
It is, and that's something that a lot of people don't know about.
I was going to say, I did not think that would be covered by Medicare. So.
Yeah, it is a Medicare right. Anyone who is in the Medicare system is entitled to hospice services, and it is covered 100% by that hospice benefit under Medicare. Hospice services are provided for as long as they're needed. So as long as someone still meets those criteria that Medicare lays out for us, they can continue to receive hospice services. So while we might have some people that come to us truly in the last few days, we have some patients that have been on hospice for a year in some cases. And then we have some patients who come on and they do so well with all of that extra individualized attention that they improve to the point that they don't meet those criteria anymore, come off of hospice. So that's another thing people don't know of.
So there's not a limitation of how long you can remain on hospice. And the reality is that some people actually get off hospice.
Yes, absolutely.
That's pretty amazing.
So, and we see that quite a bit. I mean, we have multiple patients in New Jersey who have been on with us 2 and 3 times because they just do so well having that extra attention and having that home health aide that's taking care of them and taking their time with eating and things like that.
Right. You know, an important thing is, can you explain the difference between hospice and palliative care? Because they are not the same.
No, and I think a lot of times they're used interchangeably, but they are actually quite different. So the main difference, I think, between hospice and palliative care is that hospice is for someone with a terminal diagnosis, whereas palliative care can be used by anyone. You don't have to have a life-limiting diagnosis. It's for both hospice and palliative, the goal is comfort, it's symptom management, but anyone can utilize palliative care. There's no set of guidelines and criteria that needs to be met for someone to come on to palliative care. Sorry about that. But for hospice, as I said, Medicare does give certain criteria. There's also a difference in service delivery. Hospice is a much more intensive service with, at least weekly nursing visits, home health aid services, whereas palliative, you're seen by a nurse practitioner probably every month, and they're just monitoring symptoms and making medication recommendations.
So the hospice sounds more of a hands-on service, if you will. Okay. That would be the difference. Okay.
Yeah, it's a much more intensive level of service, more comprehensive, a lot more pieces to the puzzle for hospice.
So one of the myths was about hospice is very expensive, but you've just clarified that, because if Medicare specifically takes care of it, then those of us at SCAN who are in the Medicare bracket, we don't have to worry.
Yes.
Should we need the service?
Medicaid also covers hospice, and pretty much every private insurance or managed care plan has a hospice benefit as well.
Okay. And another myth about hospice is that you no longer take any of your medications.
Yes, we hear that all the time. People are afraid to come onto hospice because they think that we're going to discontinue all of their medications. And that is absolutely not true. So part of the admission process is we'll sit down with the family and look over what medications a patient is taking. And there might be some things on there that they're taking unnecessarily. That, it's just another pill to swallow. Maybe it causes side effects that are uncomfortable. So we may recommend discontinuing some medications, but we would never stop, someone's blood pressure medications or any of the things that are necessary to keep them comfortable and feeling healthy while they're on hospice services.
Because the goal is comfort.
Absolutely. Absolutely. So the last thing that we want to do is discontinue a medication that's maintaining someone's health status and keeping them feeling good.
If someone is at, well, first of all, let me remind everyone who's listening out there, we will put all the contact info for Jennifer and Ascend Hospice in the comments on Facebook, so you don't have to worry about writing anything down. I'll put that all out there for you. But if someone is watching and they're just thinking, all right, well, you know what, it would be good to know about this in advance before I absolutely need it or a loved one needs it, what are some of the things that people need to look for in a hospice organization so that they can feel comfortable about using it for a loved one?
I would always ask about the service levels. How often will the nurse be visiting, the social worker, the chaplain? How many home health aide hours a week would I be entitled to? What are some of the extra services that are provided? For us, we do a lot with our volunteers. We have end-of-life doulas. We have Reiki practitioners. We do aromatherapy. So I would ask, what are some of the services that are kind of above and beyond your typical hospice services? I would ask about specialty programs. Depending on what your diagnosis is, every hospice has kind of a different niche that they focus on that might be something that is above and beyond that they offer. I think it's a great idea to meet with the nurse for that area so that you can see, is this someone that you're comfortable having conversations with, that you feel comfortable taking care of your loved one? Even their philosophy or their approach to service delivery. Like I said, for us, it's very individualized. We want to make sure that whatever we're doing is what is best suited for that particular patient and family.
Well, you're talking about some of the additional services over and above, but for people who are not familiar with hospice services, what are the typical services that you can expect to receive?
That's a great question. So really the way that any hospice works is they work within what's called an interdisciplinary team. So there's a medical director who's a doctor who can make recommendations for different comfort medications or symptom relief. There's a nurse case manager that's assigned to each family and patient, and they monitor someone's health status. So they're coming out and they're doing assessments and they're seeing, or is there a wound that's forming? Is someone in pain? Are they having nausea? And then they'll work with our medical director to make sure that we're making the recommendations for comfort measures. There's a social worker that's assigned to every case, and the social workers can help with a few different things. Of course, they're supporting the patient and the family with whatever, psychosocial needs come up along the way, but they can help if the family needs some additional aid hours at home. They can help connect them with a home health agency. Maybe they're helping them to prepare and make funeral arrangements. So the social worker can help with a host of connections and planning with the families as well. There's a non-denominational chaplain that would provide spiritual support to the patient and family. There is a home health aide that would They could help with personal care. They can help with feeding. They can help, just go outside on a beautiful day or read to them.
Right.
And then we have a whole host of volunteers that work within the hospice umbrella. And that is standard for all hospice companies have volunteers. They may be used in different ways. For us, we have companion volunteers, but then we also have skilled volunteers who have Reiki light certifications or massage therapy or pet therapy or music therapy. Ascend has end-of-life doulas that, like a birth doula, support the patient and the family at the other end of the life spectrum. And that's a whole certification that they go through. So those are some of the standard hospice things that you'll see from company to company as far as the hospice team that comes out. In addition to the visits, the hospice benefit covers the medications that someone needs. They cover any medical equipment that they need, having oxygen set up in the home or the nursing home or the assisted living, wherever they might be. So it really is a very comprehensive benefit. And when you think that, there's no copay, there's no deductible that the family's responsible for through Medicare, it's a wonderful service that not everyone takes advantage of.
And it really sounds like it takes a lot of potential burden off the other family members who would have to think about taking care of all of this, right?
Absolutely. It's, the coordination of having everything delivered and brought to the home and all of the different moving parts that are involved with care. Yeah.
I think a lot more moving parts than people have ever realized if you've never used the service. And it sounds like they're coming to your home or wherever the place is on a kind of a rotating basis.
Yes. So you'll have people kind of coming and going as needed, and we will work with whatever the family prefers. If they want us to visit on certain days, that's totally fine. Not everyone chooses to utilize the chaplain. That's okay as well. So again, we customize it to whatever that individual patient's and family's needs are.
This has been extremely informative.
Yeah.
I mean, this is wonderful for people who, again, are not familiar with hospice and all the wonderful services that come along with it.
I think it's much broader than the service level than many people might have realized.
Well, and I think
it's meant to be a very uplifting experience as well. We have to point that out too.
Right.
Yeah. It's really about preserving that level of functioning for as long as possible. The focus is on quality of life. So we want that those however many days, weeks, months someone has left to really be an enjoyable time that they're able to connect with their family and be comfortable and free of symptoms and really enjoy that time that they have left.
Because it's a gift to enjoy that time together,
Yeah.
which we were talking about before we came on air. So
right, especially with your family.
Yes.
Yeah. Do most people make the choice, or should I ask you, where do most people choose to have their hospice services delivered?
Going back a few years, the majority of patients that were on hospice were in nursing homes or assisted livings. And we're really seeing a shift to more and more people being taken care of at home, surrounded by their loved ones. So I would say right now, probably 30 to 40% of patients are being taken care of during their last days at home in their own familiar surroundings with their family members, which really is a beautiful thing to, be able to be in that safe space with the people that love you the most, taking care of you.
And if you choose to be at home, will someone from the hospice team come to your home and kind of assess the situation, see what you need, what do you have to purchase or whatever it is?
Absolutely. So that, I'm really proud of the fact that we're able to do it so quickly. So we'll get a call that someone needs hospice and head on over, meet with the family, see what the setup is at home. Where is the best place to, set up someone's equipment so that they're able to be around their loved ones, but, they have the room that they need and the privacy that they might want. But yes, absolutely. We'll look and see what equipment they need. We'll get that all delivered. We'll have the medication delivered. Our nurse will come out and educate the family on the medications that they'll be administering and what changes to expect. one of the other wonderful things is that we're always available to them. So we have a 24-hour triage line that's answered by our nurse. So if someone's home alone and they're seeing a change in their loved one and they're afraid and they're not sure what to do,
Right.
they can pick up the phone and call us at 2 a.m. on a Saturday night and know that they're going to speak directly with a nurse. And if we're not able to solve that problem on the phone, we'll send a nurse right over any time of day or night. They're not alone in going through this on their own.
All right, well, that's good to know. A lot of really excellent information today. Thank you.
Thank you for having me.
Yeah. Any final thoughts that you want to share at all, Jennifer?
I think that for many people, when they hear the word hospice, it's an immediate fearful response and a panic.
Yes.
But really understanding what hospice is and what those services are, that time can be an absolute beautiful, special time that's just as important as the start of someone's life. And if we can support families to be able to be present and enjoy that time with their loved one, really, as Marybeth said, it's an absolute gift to be able to share that with the family and a privilege to walk them through that.
Yes. Well, that is a beautiful way to end the segment.
Yes. Yes.
I am going to give Jennifer a shout out because she is facilitating a stress management workshop for us this fall on September 30th. And maybe Andrea can put that in the comments section if anyone wants to participate.
I will. September 30th.
Yes.
Yeah. Forward to that.
Yes. Thanks, Jennifer. Well, thank you for being our guest today. Andrea, I'll let you close us out.
Yes, thank you. Jennifer Dral of Ascend Hospice, which is in Rahway, New Jersey. Again, I'm going to put all of the contact info in the Facebook comments. I think we all, I think everyone, I would say we learned a lot. Very informative, excellent today.
Thank you,
Jennifer. So remember, if it's important to you, it's important to us. I'm Andrea Tarr, and we'll see you next time. That's next Wednesday, 9 a.m. on Facebook. We'll see you next time on Scan FYI. Bye, Marybeth. Bye, everyone.
Great day, Jennifer.
Day.